Here's a quick walkthrough of some self-massage you can do at home to help take care of your jaw. There are 4 pairs of muscles that we'll be working with. The first is the temporalis, and the temporalis lives on the side of our heads. It's a broad fan-shaped muscle, and to massage it, just take your finger pads, gently massaging the front of the fan, and then the middle of the fan, and the back of the fan. And you'll notice that I'm sort of starting at the ear and then working up towards the top of the head. And that's just a way to keep things systematic, so you cover all the territory. Along the way, it's likely you'll find some spots that are more tender or want more of your attention. And that is a nice treatment for the temporalis muscle. It has a partner on the outside of the skull, the masseter muscle, which spans from our cheekbone down to the corner of the jaw, the lower jaw. It's the one here when I clench. You can see it pop out. So for that muscle, again, using broad finger pads, 2 or 3 at a time. I start usually at the cheekbone and just gently drop below the bone and massage. And through there. Small circles, or you can do long little stretches, whatever feels good. The technique, the touch, the type of touch you use doesn't have to be fancy or very particular, fussy in any way. Just coming in and giving a gentle massage to soften up the tissue, loosen up any places that are stiff or tender, and all of it will bring in new, fresh fluids and blood supply to help soothe the muscle and feed the muscle. So that's for the masseter. There are 2 sets of muscles on the inside of the mouth that you can treat by yourself. The first is, I'm going to use this prop of the skull here. The first is when we open our jaw, we have a muscle that lives on the inside here. Don't do that. That masseter here lives on the inside, the back part of the lower jaw, directly behind the lower teeth. So there's me holding. You'll notice that the lower teeth match up right in line with where this muscle is. So I'm going to use my finger, glide my finger along the lower teeth as a way to mark where I'm going, and I just continue as far back as I can, and the tip of my finger will bump into that muscle. And then I can gently do the same little circles or tiny little lines to just kind of stretch that muscle just a tiny bit using the tip of the finger. So this is what that looks like. Gliding. You'll want to wash your hands first or use a glove. We're gliding along the lower biting surface, and then I bump into the muscle. Doesn't take that long. There's about that much room that you'll be able to contact easily with the tip of your finger. So coming in and just doing little tiny scoops and little sort of pressing into the muscle. It might be tender. It's better to do this a little bit at a time, more often, rather than doing it a whole lot and everything gets tender and a little bit sore, and then you shy away from doing it for several days at a time. So better to do just a little bit, like I did, maybe 30 seconds. 30 seconds on the other side. Here I go. The second muscle that we'll be treating on the inside of the mouth is tucked away high up in the back of the mouth. And our approach for reaching it will be to use our pinky along the outside of the upper jaw. If this is my jaw, what I'm going to do is bring my pinky inside the mouth, up over the biting surface on the upper jaw here, and then gently glide my pinky back such that the very tip of my pinky goes into this little tiny nook in through there. I'll meet some resistance with the tip, and I gently engage that tissue, increasing the pressure. This one is often tender on people, but again, if you visit it a little bit every day, maybe 30 seconds twice a day, that will help give the muscle the signal to learn how to relax more often and more easily. So this is what that looks like from with a real person doing it. So I bring my pinky up in the cheek, slide it above the gum line in that little tunnel, and back I go until I bump into the tissue at the fingertip. And there it is, kind of tender. And I just hang out. Count to 2 or 3. Take some nice breaths. As the tissue softens, I gently glide my finger farther back. 15-20 seconds, both sides. Here it licks on the other side. Finger comes in above the gum line. Pinky glides back. I bump into some tissue, and then I'm just getting a little extra pressure into that muscle belly. And it's tight. It's tight on almost everyone I've ever worked with. But hang in there, have some patience. And then when you release, helping just gently moving the jaw around and feeling the openness in the range. So these simple exercises you can do, as I said, once or twice a day, not for prolonged periods, but a little bit often is what will help your jaw learn how to relax and decrease the tension that we tend to chronically hold there.